Welcome to the latest edition of the Kellen Association's Unplugged podcast. Today we're talking about NGOs and how they can work with associations, or more to the point, how associations can work with NGOs. We've got a very interesting example, the Iodine Global Network, and I'm delighted to be joined by Werner Schultink, Executive Director of the Iodine Global Network. Werner, thanks for joining us today. Tell us a bit about what your association does.
Thank you very much for having me. We are a small organization based in Ottawa in Canada, and we have as objective to monitor the global situation on iodine deficiency and programs to prevent it, and also to provide countries and partners with advice and guidance on what they can do to prevent iodine deficiency.
What is the issue with iodine deficiency today?
Iodine is a trace element which you need in very small amounts, but it is essential for the functioning of the thyroid. And the thyroid regulates energy metabolism and growth. So if you are deficient and severely deficient, your growth will be compromised and brain development will be compromised and your general energy metabolism will be compromised.
As I understand it, this is an issue that to a certain extent you have had a lot of success with. I mean, the situation with deficiency now is much better than it was, say, 100 years ago.
First of all, iodine deficiency is not only an issue in what we think about in developing countries. It's a global issue. It was a huge issue in countries such as Switzerland and many other countries in Europe, but also in the United States, Canada, and so on. Due to really good interventions based on the iodization, adding iodine to salt, the severity of the problem has basically disappeared throughout the world. And I think it's one of the biggest public health success stories of the past 100 years.
How much of that was due to the work of your organization?
I think my organization was at the start of all the programs. My predecessors worked to identify the magnitude of the problem. They worked to identify the severity and the impact of the problem. And they helped to provide evidence and information to the United Nations, specifically the World Health Organization, for the World Health Organization to give advice to countries, to all countries in the world, to put iodine in salt. Okay,
and so what's the sort of regulatory mechanism? Does it become a law that companies have to put it into salt? How does it work?
About 120 countries worldwide have regulations and laws which makes it mandatory to add iodine to salt. And in the majority of the countries which have these laws, you have basically no more iodine deficiency. At the moment, we think there's less than 20 countries where you still have a problem, but in the overlarge majority, the situation is fine.
I mean, I see there's a recent report that you released with the WHO. People in Europe, the European region, at greater risk of iodine deficiency due to changing diets. So what's happening now? Why is this problem, in fact, starting to get worse again?
Well, like I said, it always was a problem in Europe. And, you know, if you don't have iodine in the soil, you can't make up for it by shifting diets. So, for example, eating more beef or eating more vegetables. That is not possible. So you need to get it from an external source. And what we've seen is that due to changes in lifestyle and changes in consumption, iodine deficiency is coming back. For example, households eat more pre-prepared foods and processed foods. And in most cases, those processed foods are not prepared with iodized salt, but with salt without iodine. And then there is a shift in consuming less dairy, milk and cheese, in favor of, let's say, milk such as almond milk or soybean milk. And those alternative milks do not contain iodine. Dairy is in many countries a good source of iodine due to sufficient amounts in pasture, but also because farmers give iodine supplements to their cattle, their chickens, and so on, to assure adequate growth.
So you have that kind of assuredness for animals, but not always that assuredness for people.
That's the beautiful irony.
Okay, so what's the link with salt? I mean, why is salt the suitable, let's say, means to transmit iodine to people?
The nice thing about salt is that first of all, it's eaten by almost everybody. And you have it also in very predictable amounts. So almost everybody in the world consumes salt at an amount between 5 to 10 grams a day. Whether you're poor, whether you're rich, most people have salt. And this high level of predictability of intake, combined with the fact that almost everybody in the world uses it, makes it an ideal food to fortify or to add iodine to. And the other beautiful thing is that you only need to add an extremely small amount of iodine to salt. For your whole lifetime, you only need about a teaspoonful of iodine. So when you fortify salt with iodine, you add it in terms of parts per million. And that makes it relatively easy.
But there is, I guess, a growing awareness. I don't know if it's based on fact or not, but a growing sense that salt is perhaps not a healthy part of people's diet. So I guess there are some people who are disavowing salt altogether. No, I'm not going to eat it anymore. Would you advise against that?
No, I mean, the effort of the World Health Organization to reduce salt intake is based on the fact that it helps to reduce non-communicable diseases such as cardiovascular disease. And they recommend that salt intake is reduced quite a bit. But because you add only such small amount of iodine to salt, it is easy to add a little bit more. And even when you consume less salt, as long as you make sure that the salt is iodized, you still get enough iodine.
Okay, but there are people who are cutting it out completely, I guess.
If you're cutting it out completely and processed foods are also no longer made with salt and you avoid it completely, then you would run the risk of becoming iodine deficient.
So from your organization's point of view, what's the solution?
Well, the solution is very easy. If you stick to the WHO recommendation, but if you make sure that the salt you consume is iodized, then basically at the population level, you are, protected.
Sure, but I mean, I think it's a fact of life that people will be less likely to take iodine for these reasons. And so what can your organization do to address that? Are you looking at fortifying other types of food, fortifying processed food?
For now, the shift in salt consumption is relatively modest. And there may indeed be individuals in countries who kind of completely leave out salt. But the way we look at the problem is at the level of a public health level. So the whole population should be protected, and we're not focusing on individual problems. So that is where we come in.
At sort of regulatory level, is it always mandated? Is that what you prefer? That this is always part of the law?
There are many countries where it is not mandated, and if you look at the Europe report, it is very interesting. You see several countries in Europe have a mandatory situation, and where salt is fortified by law, and all salt, also what uses in making processed foods is iodized, they have no deficiencies. In other countries where you have either voluntary use or no use, you have most deficiencies. An example of that includes Germany. It includes, I have to think now, I think Italy, Belgium, and even Switzerland. Pregnant women are now again mildly deficient.
So you see in those countries, you see the direct impact of the difference in policy?
Yes.
And is that where you're lobbying? Are you talking to German health authorities and say, really, this needs to be mandatory?
I mean, the German government itself has begun an awareness-raising campaign on the need to pay attention to salt iodization and on the need to consume iodized salt instead of non-iodized salt. I think that's very important to realize that we are not, I repeat, not advising people to eat more salt. We're just making sure that instead of non-iodized salt, they use iodized salt.
Well, why would they not make it mandatory?
I think there's issues of free choice and awareness raising. And in some countries, they do have a focus on the use of iodized salt in specific food products. Bread is an example for Holland and for Belgium, and that can work. But if it is completely voluntary, most people don't know anymore about this problem. So if you're in a supermarket, you see 2 or 3 types of salt, and in most cases you'll see in a supermarket that salt is somewhere at the bottom level, and you just pick one and you don't pay attention to it. And if you don't pay attention to it because you don't know about it, what can you do? So that is where mandatory would help, or awareness raising of the consumers would help.
Has it gone to the extent that we see in, for instance, European countries that the health outcomes of not having enough iodine are becoming manifest? Are we seeing people with intellectual problems and so on as a result of the deficiency?
There was a big study in the United Kingdom where they did find that offspring of women with very mild iodine deficiency had an impact on development, and they followed it up. But there are other studies where they had more difficulty finding such an impact. But what we do know is that if you don't have enough iodine in your food, the thyroid gland works harder to absorb iodine from the bloodstream. And if the thyroid gland chronically, over a long period of time, has to put in extra work, you do see a small enlargement and you start to see the formation of nodules. So what we do see in Europe, in countries where iodine deficiency is becoming again a problem, you see more occurrence of this negative thyroid health status. And that has medical consequences and cost consequences.
Overall, would it be fair to say that this kind of emerging deficiency is a result of your association being a victim of its own success? You've done so well that people have started to take this whole issue for granted.
Yeah, I think that's maybe a fair way of putting it. The issue is, though, that you cannot eradicate iodine deficiency, such as the eradication of smallpox. You need to continue to work on it. And if you stop working on it, it will come back. And people may argue that the level of deficiency in Europe is not yet so severe and that the consequences are hard to see. But from my perspective is that in let's say, developed and wealthy societies in Europe, why would you run the risk?
Yes.
Why would you put your population at risk if you have such a cheap and effective solution at hand?
Are there any conspiracy theories about iodine? Did you have the same thing that you have with fluoride, where people say that it's an effort of...
No.
No, okay. That hasn't happened yet. No. Okay. How would you characterize your relationship with industry, with the salt industry, for instance?
I think the industry is extremely important for our work. After all, it's a salt industry who iodize salt, not the government. Government implements a measles vaccination campaign, but the salt industry produces iodized salt. And we had a participation from the time where I worked in UNICEF at a big salt producer conference in The Hague, where we made a presentation to the global gathering of salt producers on the need to add iodine to salt and the important role they can play to protect their population from this deficiency. And I must say that by and large, salt producers have taken this message to heart, and they are, working with us and with other organizations of the United Nations and other organizations to do indeed what they should do.
What's in it for them?
I think what's in it for them is not so much in most cases, a real difference in profit or price. I think what's in it for them is knowing that they contribute to public health.
Okay. As simple as that. It's sort of corporate social responsibility on behalf of the salt industry.
Exactly.
How did you get into all of this? Is this something that you're doing out of passion? Is it about giving back? What's your motivation?
So the past 20 to 30 years of my professional life, I've worked on various angles on iodine deficiency, the research angle, and then on an angle from programming and helping countries to do this at large scale. I have a career of more than 20 years in UNICEF, 9 of which as the global chief for nutrition in UNICEF. So I'm now in my retirement age picking this issue up again because I think that the world deserves to be rid of this deficiency forever.
The organization itself, like its staff, I guess it's quite small, but you've done tremendous amount with kind of a small team. What advice would you give to other NGO leaders about how to be as effective?
Well, that's maybe a difficult question. First of all, our area of work is very focused, but on the one hand is a very severe problem. And on the other hand, very doable and cheap solution. And the other thing is that it doesn't cost governments much to do anything about it. You just need to monitor and control it.
It's a no-brainer. It's a quick win.
No-brainer. And then the good thing is that in our organization, we have coordinators in countries, in more than 100 countries, who are volunteering their time, but who are passionate about the subject. Then we have a group of 10 people working at regional level who work with these national coordinators. And then on top of that, I have a small team of 7 people who are engaging with these people. But we all work from different places. We don't have an office, so we are very lean and just go about helping, to tackle the situation and to improve it.
A lean structure, passionate and committed people, you can achieve a tremendous amount. Werner, thanks very much for joining us today. It's an inspirational story, and I'm sure that it will be very affecting for the people listening to this. So thanks very much.
Thank you very much.
To continue the discussion, we're joined now by Adriana Nosewicz, who is Managing Director of EU Salt, also working at Kellen as a director. Adriana, tell us a bit about your connection with the Iodine Global Network. How is your association working with this non-governmental organization?
Thank you for inviting me here today and for giving the positive story of what industry working with the NGOs can do together. I'm dealing with the association for the last couple of years, and since the beginning we did try to address the issue of iodine deficiency, but we were not very successful until the IGN came to us and said, look, we need to bring it to the next level. We need somebody else to talk about it, but we need data from the industry to support us in drafting. I will be honest, it was not easy to convince the members to give the numbers to the NGO. You never know what will happen with this kind of information. So we spoke a bit with the competitors. They are competitors in the associations, right? So we had to make them feel comfortable about giving this information. We had to make sure that also lawyers were involved, that no confidential information, commercially sensitive, would be exchanged. And after a couple of months of discussions how to do it properly, we did manage to give the numbers that IGN could take further.
What was the specific type of data that they were looking for, and why was it sensitive?
It's production consumption data. That's something that is, quite, companies are very sensitive about talking about those. But if you understand why you do it, how you can help somebody with giving it, you find a way to do it.
Okay. Do you find that an association will work in quite a different way to a non-governmental organizations? Is there differences in culture? Can you explain that a bit?
From my experience, yes. It's a business organization. Trade association is a people who are working very quickly, very quickly. Trade association is not a company, but still it's quite quick. So things have to happen efficiently in some timelines, deadlines, with a plan, with some bigger goal to achieve in a concrete time frame. So we are very pushy, you could think. Whereas NGOs have another pace, from my experience, working on things with their own pace. My worry was a bit that I saw the NGOs talking to each other. Okay, they all know about it, they're all passionate about it, but they do speak to each other. Where actually the problem is outside them. It's with the society, it's with the legislators, it's with the producers of salt or of processed food who is not using the fortified salt. So that's why our idea was, that we can work together and we can open the door that you actually are not opening because you're not here, because you're small, because you don't have enough people. And we are here, we can look at this different perspective. For example, the fact that, who is putting the salt on the market, salt producer, all producer of final food, but he will put it on the market only if the legislation allows for that, and if people want to buy it. If people want to buy it, they need to be aware why they want it, or that there is nothing wrong with the product. Sometimes what we noticed is that people do not want to buy it because there is an additive, there is a chemical compound. And that's something that scares them. Now,
is this in situations where it's not mandated? Because if it's mandated, it's going to, by default, be there.
Yeah, but then they still will tell you, look, there is an additive, and they tell us to buy something with additive, where actually you can have something from Himalaya that is pure. There have no chemicals in it. It's pure salt, beautiful and pink. So we have to also make people aware that it is not the additive that will make you feel unhealthy.
Are your members in favor of it being mandatory?
Probably yes. We don't think that it's such a big, that there is a huge possibility. You have to be realistic. I don't think it's realistically possible that today it will become mandatory. If it is, you just meet the legislation. But already the principle of mutual recognition would help. In the European Union, you have the product that is put on the market in one country should be allowed to be in another country. And actually, it's not always working like that.
Really?
Absolutely.
No single market?
That's how it should be. But no, there are countries that say, no, products that are iodized, fortified with iodine should not enter. So, for example, the bread from one country cannot be sold in a country where the legislation is different, right? And you also have to remember that the health is not a domain of European Union. It still stays as a prerogative of a member state.
I mean, again, we heard from Werner that the salt industry has been extremely supportive in this. Is it just corporate social responsibility on behalf of your members? I mean, what's motivating them to support?
I know it's difficult to believe, but it is. It's really, sometimes you want to do good, okay? Yeah. You really, if you think of salt actually is sold to food, it's only 7% of the business. So it's not that it will have a massive impact on the business, but you sometimes really want to do good. Because normally when you think of salt producers, of salt as a product, you think this is something that makes you unhealthy. Where actually we say reduction of salt and iodization of salt go hand in hand. And you can actually do something good. It really makes you feel that you can give back as well. That's why I very much believe in dialogue, in trust. You see more and more organizations that will tell you, I'm not coming to this panel discussion because there is industry on the panel. And then you wonder why. If actually you have the same goal, if you can do something together, take some time to engage, to build a trust, and do something together. Talk, meet halfway. This is very important in today's world where you see where we're living. People believe that only they are right. Here, as a trade association, you already have a first filter that competitors have to come together and resign from something. And then you come to the next step. So actually working with NGOs is another role of the trade association in not only as a lobbying business organization. We discussed some time ago the role in the democracy, but here is also a role of trade association in society. But what the trade association, the industry organization can do.
In this situation, we see that the NGO gets access to data and gets that type of support, but I guess this needs to be a win-win collaboration. What does the association get? Is it easier to, for instance, connect with policymakers if you're supported by an NGO?
I think it's the trust is easier. As you say, it's easier that somebody is trusting the trade association. If you go and ask for a meeting and you say, well, it's not only the industry asking, but we are actually working with doctors, with researchers. We are coming here together. That it's true. They do see you more trustworthy than just when you say, I want to sell more. That's why I come to explain that there is a problem.
What advice would you give to somebody who's working at a trade association and wants to develop this type of coalition with NGOs?
If you believe that you can do good, don't be scared. Trust, look for it, look for somebody who has a similar goal. Sometimes go halfway, meet and talk, build the trust. The building of the trust takes time, but it's important and it can really change a lot.
Do we kind of assume that NGOs are going to be less reluctant than they sometimes are? That they might be more open to a collaboration that we would first think, looking at it from an association point of view?
I hope so. Because I do believe that there is also something for them, that they don't have that many resources. They don't have so many connections that we have. They don't, this is not their core business, going and speaking to those with whom we speak. So I think that there is a mutual benefit for both of us, not to mention the benefit for the society, right?
Yeah, and it's a small part of the business for your members, right?
Yes.
Okay. And so again, it's just giving back and maybe getting some benefit from that.
Absolutely.
Adriana Nosewicz, thanks for joining us today.
Thank you for having me.